We are purely a grant-funded program based on philanthropy and things like that. There is no funding mechanism today for something like ECHO other than applying for federal grants, which of course I applied to AHRQ, and I'm grateful
Yes.
for it. But
Yes.
I think
Yes.
that over the long term, there should be a mechanism for a rural clinician to be mentored on best practices. Because one of the challenges, Kathy, we are having is best practices are improving exponentially. New knowledge is being created exponentially. But we don't have an exponential way to disseminate it. Of course, we have Google, but we have the internet, but that doesn't help a doctor implement that knowledge.
No.
So a telementoring platform that builds communities of practice and allows a rural clinician to have a continuous mentoring mechanism to keep up with this absolute waterfall of knowledge coming down will be actually very helpful for us to have a lower cost system, because we can treat disease early, we can prevent disease, and more effective and safe healthcare system where people get best practice care where they live, rather than having to have long waits to see specialists, etc. So the first two I know will occur. The third is a hope will occur.
Mm-hmm. Well, that might be the only silver lining of the pandemic, if that were to occur. So, Dr. Arora, I just want to thank you so much for your time. It's been a real pleasure to talk to you face to face. I've certainly been familiar with your work for years, so it's been an honor. And on behalf of AHRQ, we would like to extend our appreciation for all the fantastic work that you have done and are continuing to do.